New Zealand, let's give a big, warm welcome to Dr. Miriam Grossman, live from New York. So we are good to go. Nice to see you. Now, Miriam, do you just want to say hello to the crowd, just so we can make sure we've got good audio?
Yes. Hello, New Zealand. Hello, Kiwis. Can you hear me?
Okay, so she can see the crowd, can she, guys? Okay, that's the main thing. As long as you focus on me when I'm asking her a question, just so she knows where the question's coming from. Miriam Grossman was last in the country in, I think, about 2012. We went and found the kosher cafe in Auckland that I never was aware of, had my first kosher coffee with her. She was a great speaker, and at that time, gender ideology wasn't even in the mix. We were talking about the sexuality type education, and it was based on her book, which was entitled You're Teaching My Child What? And it's a 2009 book. We've got the image of the book there, and it was when I was in Washington DC at the Values Voters Summit that I first saw this book, and I thought, we've got to speak to the author of this book. And so we invited Dr. Miriam Grossman to come over, and she spoke at our conference, which was out at Life Church when they were out at the airport originally. So, Miriam, I thought just to start with, could you just give us a very quick Reader's Digest version of the book, You're Teaching My Child What? What was that book about?
Okay, the Reader's Digest version would be, that was a book that exposed the radical agendas that exist within so-called comprehensive sexuality education. And in each chapter, I describe how instead of being based on science, instead of being focused on the health of our children and our young adults, that sexuality education is based on sexual freedom, experimenting, exploring, teaching young people about every variety of sexual activity, and just putting images and ideas in front of them that are in many cases obscene and most certainly not age appropriate. But the gist of that book, Bob, was to wake people up, especially parents, so that they understand when they're told by schools and teachers and doctors and policymakers that this is all going to be so good for your children and it's going to keep them healthy and it's just going to give them the information that they need to stay healthy, that you take that with a grain of salt, and you yourself have to dig into the curricula and what is actually going to be told to your kids. You cannot take their word, that you cannot trust them unhappily. I have to say, you simply can't trust them because they say one thing and then they go and do another. Now, the thing about that book that came out in 2009 is that I had a chapter there about gender. And it had never occurred to me until I started studying sex education that kids were being told that there's such a thing as gender versus sex. And kids were told that sex is between the legs and gender is between the ears in your mind, and that sometimes it's just a variant of human development. Those two things don't match. Gender and sex sometimes do not match. And when that is the case, gender overrides sex, and that person needs to change their bodies so that their bodies are congruent with their minds. This was back in 2009, and I warned parents that this was going to be a disaster. We cannot be teaching kids this. It is not true. It is not based in medicine. It is not based in science. And it is going to be a disaster for our kids and our communities and our society if we do this. Now, sadly, I was right. And I don't know exactly where you are in New Zealand right now with this issue. I know where we are here in the US and in many other countries, and we are facing that disaster.
So as a result of that, we commissioned a report from you on, and we got you to look at all the New Zealand resources that were going into schools. And we produced this report, R18, and we've got an image of that report cover. And your key quote was, basically you said of the New Zealand sex education resources, they're seriously flawed, the information is not accurate, comprehensive or up to date, sex is seen as risky only when it's unprotected, the efficacy of condoms is overstated, the vulnerability of the immature cervix and the hazards of anal intercourse are admitted. Chlamydia is incorrectly described as easily cured. Young people are led to believe that sex is easily divorced from emotional attachment. But worst of all, if you can get worse after that, critical life and death information is distorted or ignored. That report was a revelation on just how dangerous. It was kind of the first red flag in New Zealand of just how dangerous the agenda was in schools. New Zealand was no different to other countries, was it?
No, what I saw in your sexuality education was exactly what I was seeing in other places. And there's a reason for that. It's because this is a worldwide phenomenon that organizations like International Planned Parenthood and, the United Nations, UNICEF, and different international, very powerful, well-funded organizations are presenting the same ideology all over the world.
Okay, let's get straight into your book, your new book, Lost in TransNation, and we encourage everybody here to buy this book. I was going to say it's a great read. It's a disturbing read. And I want to just quote you the opening quote from it. It says, so this is you speaking, "When I graduated from medical school, I took an oath. I stood up, raised my right hand and vowed to prevent disease whenever I could. But after 40 years, I've realised my most challenging fight is not against dangerous diseases, but dangerous ideas." Do you want to just comment on that?
Yeah. Well, there are lots of dangerous ideas. The ideas that my most recent book describes as very dangerous and faulty are ideas such as a person can pick their sex. A person, a child, no matter what age, no matter what their developmental status is, whether they're autistic or what have you, can pick whether they are male, female, or some other variety or identity. That's, there's now dozens and dozens of identities that kids are told they can pick from. Now, that's a very dangerous idea for a few reasons. One is that there are only two sexes, male and female. Sex is a biological category. It is something that is determined by what sort of reproductive cell or gamete a person's body is designed to create, either sperm or eggs. Those are the two possibilities. So there are only two sexes. All mammals, and we are mammals, all mammals are either male or female. Now, are there extremely, extremely extraordinarily rare cases of people who have a genetic disorder or a hormonal disorder and they have genitalia that is not, it is atypical. It is not look the way that it's regular normal genitalia look? Yes, there are very, very rare cases, but that doesn't change the reality that we are all male or female. The fact that there are those exceptions doesn't mean that there is a third sex. It doesn't mean that sex is on a spectrum. And so that's an idea, the idea that they're putting in front of kids, that there are many genders, many sexes. By the way, they're not synonyms. Those two words are not synonyms, but they are widely used as synonyms. The idea of telling kids that sex is on a spectrum is false, and it's dangerous. And it confuses young people in a very deep manner. I mean, our identities as male or female are at the core of our humanity, right? It's the first question that we ask when a child is born, or even, when a woman is pregnant. Can you imagine meeting somebody and it not registering in your brain whether they're male or female, and then an hour later you're talking about that person and someone says, "Oh, I didn't catch it. Was that a man or a woman?" And you say, I didn't notice. So we are created male or female. We are also created to recognize within a fraction of a second whether the person that we are speaking to or looking at is male or female. So that's one dangerous idea. It's a destabilizing idea that's being put in front of our young people as early as preschool, at least in my country. This idea is being promoted in books that are written for kids who can't even read yet. These books will say things like, "Only you know if you're a girl, a boy, or something else. Your parents or your doctor or other people may have made assumptions about who you are when you were born, but those assumptions may have been wrong. It was just a guess. It was a guess. It may have been correct. It may have been incorrect. And now you get to tell the world who you are." This is not only a false idea, but it's a very destabilizing idea. What we want for young people is to have a strong sense of who they are. And this, as I said, goes to the core of who a person is. And if we are teaching them, if kids are constantly being bombarded with this idea that they can pick their sex, and that it may just be an error that they're being called a boy or a girl. It may have been a wrong guess. An incorrect guess is an extremely destabilizing, anxiety-provoking idea to put in front of a child, because, mind you, they begin to think not only about themselves, but about the rest of the world. What about their mom? Is their mom really a man? Is their brother really their sister? So you can see how this is extremely destabilizing and dangerous. And it's the kids who are vulnerable to these ideas that suffer. So if the child, and this is what we see in my practice, I see kids and young adults who are struggling with their so-called gender identity, and I see their families, their parents. So it's widely known that the kids that are most vulnerable to these beliefs are kids who have other issues, that many of them are on the autism spectrum. They have anxiety. They don't fit in with their classmates. They feel like outsiders. They might have depression. They may have a history of trauma. Some of them have a history of sexual trauma, of having been molested or abused. And, you don't have to be Sigmund Freud to understand that if a girl or a young woman has been raped or sexually molested, or even, continuously objectified and stared at for her changing body and her feminine body, she may begin to think, I would rather be a boy. because if I'm a boy, this will not happen to me. So we see that happen, and we see all sorts of scenarios of young people falling into this cult-like belief system, which has now taken over. I mean, what should I say? It's taken over our educational system, our legal system, medical organizations have been hijacked by small groups of activists, and we're really in trouble. Now, here in the US, I might be jumping around a little bit, but ever since Trump got into office, there's been quite a, and even before that, there have been some big positive developments. And I can go into those a little bit, Bob, if you want me to. But we still have a very long way to go. Other ideas that I cover in my book, the name of the book is Lost in TransNation. Other ideas is that teachers know better than parents what's good for children. And this is very widespread. There are activists in the schools, and they come in and give training sessions to the teachers and the administration and the staff of schools. They call them training sessions, but they're really indoctrination sessions. And the reason I use that term, indoctrination, is because, and I've been in these sessions, false ideas are presented over and over again with no opportunity for discussion or debate. So that is the definition of indoctrination. You're going to be hearing the same thing over and over again, ideas that are not valid, and you're not given a chance to debate. And if you do try to question what you're being told, you are immediately marginalized and made to feel like a bad person. So that is what's going on in the schools. And what we have here over and over again is schools that are stepping in and hiding from parents, loving, devoted, good parents. They are hiding what is going on with the child at school. They are permitting the child to use a different name and different pronouns and use the opposite sex bathroom and go on overnight trips, you know, with their class and stay in a room with the opposite sex classmates without the parents' knowledge. So it's a very dangerous idea for school administrators and teachers and guidance counselors to think that they know better than parents what's right for the child. Now, in this country, in the US, parents have a constitutional right to direct the upbringing, the education of their child. And so there are lawsuits that are being brought now against schools based on the rights of parents. And I don't know how those lawsuits are going to end up. It's going to be, depend on the judge. It's going to depend on whether they go to the Supreme Court or not. We've had some good results at the Supreme Court recently. But for those families that have gone through that and that have discovered after months and months, all of a sudden they discover that their daughter, for example, has been using the boys' restroom, and that their daughter is being called he and him, and a boy's name is being used. Therefore, in doing so, the school is placing a wedge between the child and the parents, a significant wedge. And they are leading the child to believe that, you know what, we know you better than your parents do. And perhaps your home is not a safe place to be. So they introduce all these ideas, and this naturally leads to kids who run away, kids who, following the advice of people online or in schools, will run off to some other family, an affirming, we call them glitter families, and it's a nightmare. It's a nightmare. So the idea that schools know better than parents, and I'm going to throw in there the idea that therapists always know better than parents and doctors know better than parents. These are all dangerous ideas that we're dealing with in the transgender issue, and I cover in the book.
I thought I would sit down because it's more natural for me just to chat to you like this. And I knew that once I asked you a question, you would just cut loose with a whole lot of common sense. So it just made a whole lot more sense. I do just want to ask you about the gender difference. The previous trend was that it was mainly males who wanted to be females. But there's been this mass explosion and the trend has gone from females wanting to be males. Why is that?
Okay, well, first let me explain, Bob, that until 10 or 15 years ago, the cases of children and adults, the cases of anyone having the symptom of gender dysphoria and being intensely unhappy with their sex bodies was extraordinarily rare. So rare that when I went to medical school and I did my training as a psychiatrist and then a child psychiatrist, it was so rare that we never expected to see even one person in our entire lives. This was something that we read about in our books. So it was extremely rare. Now, the symptom of gender dysphoria, of intense unhappiness with one's body and a desire to be seen by others as a member of the opposite sex, it's real. It is a real symptom, and it can be a very debilitating symptom. But what we know is that at least the research that we have from years ago about the typically it would be small or younger boys who were very feminine, and they would wish to be girls. There were even more unusual the other way around of girls wishing to be boys. But what we do know is that in most cases, the studies show that anywhere between like 68 and 98% of these kids, if they were just given support and their families were given support and they were not transitioned, okay, they were not given a new name and new pronouns. They may have been permitted, to have long hair or to wear certain, outfits at home, but it was kind of kept under control. And we know that by the time they reached young adulthood, after going through normal biological puberty, regular organic puberty, that the vast majority would be fine with their bodies. They would get over this unhappiness with their bodies. A lot of them were gay or lesbian, and they were gay and lesbian people who were perfectly content with their bodies. So they maintained their health, they maintained their sexual function, and they were able to live their lives. Unlike these kids now who are being automatically rubber stamped, their new identities are being rubber stamped without exploration, without asking questions, without saying, hold on a minute, let's just look at other things going on in this child's life, in their family, at school. Do they have autism? Do they have depression? And asking all those routine questions that we always ask every patient. In psychology and in psychiatry, we always do that sort of evaluation. But now we're being told not to do that. Now, to get back to your question. So those kids originally were mostly boys. What happened about 10, 15 years ago is that we entered into a skyrocketing numbers of, of kids who were adolescents, well, coming into adolescence or already in adolescence, as opposed to the much younger kids that we were always seeing before. And so they were older. They had no history, most of them, of any gender incongruence or unhappiness. They had been fine with who they were, and a lot of them were very masculine boys and feminine girls. But suddenly, over the course of months, sometimes, they would come out and announce that they were no longer, they'd say to their parents, I'm no longer your son, I'm your daughter, or vice versa. And these kids had a history of having been immersed in social media. So they were mostly girls. They were mostly girls who had been fine with being girls before this time. They were girls who, now this is important, most of them were in a friend group, either online or in real life, in a friend group in which there was one or more other girls who were also identifying as boys or as non-binary, which is a term, a nonsense term, which doesn't really mean anything, but I'm just throwing it out because that's a term that's being used. So this was a brand new population, a totally new demographic of individuals that were suddenly appearing in the offices of therapists, pediatricians, and gender clinics. They were adolescent girls. They were girls who had a lot of comorbidities, coexisting emotional disorders. They had a history of trauma, of autism, some of them, of depression, cutting. Some of them had a history of suicide attempts. So they were identified, almost all of them, as having concurrent emotional issues. So this was a brand new population, and that's important for us to recognize because the other side, the proponents of so-called gender-affirming care, deny this. And they just lump everyone together. And they say, well, there's no such thing as rapid onset gender dysphoria, ROGD, which is what this new population is now being called. Rapid onset gender dysphoria. Is it an official diagnosis that's already in the books, in the DSM, the Diagnostic and Statistical Manual of Mental Disorders? No, it is not yet in there. And the reason why it's being pushed back against, the reason why there's such pushback against the idea that a person can develop gender dysphoria as a result of a social contagion, as a result of hearing about it from your friends online, watching YouTubes day and night, and then developing these symptoms yourself. The reason the activists on the other side fight against this is because they want everyone to think that gender dysphoria is inborn. It's something that you are born with and that is not going to be treated in any way except changing the body. And it's very, very important to them. That's part of their whole approach to this issue. So that when people on the other side, on the side of reason, on the side of logic, and on the side of reality, say, look, we have all these kids now, mostly girls, and we know that girls are susceptible to social contagion. A social contagion is when an idea or a behavior or a feeling spreads within a friend group. And we know that that has happened with eating disorders, with self-injury, cutting, with suicide attempts, and we know that girls are more vulnerable than boys are to social contagions. And so they want to push back very hard against this idea, because if it's a social contagion, it's not inborn. It's something that's related to the environment. It's something that this vulnerable person somehow got attracted to and got convinced that it is the solution to her problems. And this is basically what happens. A young person, not only girls, but boys as well, will go into a gender clinic, and the first thing they're going to be asked is, how do you identify and what are your pronouns? And when they proclaim their identity and their pronouns, it is given that they know best who they are, and that the therapist, the doctor, the endocrinologist, the surgeon, everyone has to affirm that identity. Now, this is the only thing in the entire field of medicine in which a patient comes to us and we immediately say, you're right. You're 100% right. I don't have anything to say about that. I'm going to consider you a boy. I'm going to use this new name, and I support you in your new identity. There's nothing like that in the world of medicine, and certainly not in psychiatry, because these kids who believe that they are the opposite sex, in essence, they have a delusion. Many of them. A delusion is a fixed, false belief. A boy cannot become a girl. It is impossible. And we also are not born with a disjointed, a body that does not match the mind. We are not Legos that can be assembled improperly with with a mind of a girl and the genitalia of a boy. This is not feasible. This is not scientifically accurate. But these kids, because of what they're hearing 24/7 online, at school, from the entertainment industry, from their friends, and sometimes from elected officials and government agencies, they become very, very profoundly convinced of it.
So could you explain... Could you explain to us why so many medical professionals and medical professional groups have bought into this? Is it because the advocates have done such a good job at shutting down any dissent and getting people cancelled for not agreeing? Or are we missing something here, that so many medical professional groups have just kowtowed and rolled over on this issue when it's obviously a dangerous ideology?
Okay, a few things. Yes, they have done a very good job, I would say, at capturing, taking over these associations. What will happen is that a small group, commonly like an LGBT caucus or committee, that all organizations at this point have in medicine. You'll have a caucus, a small group of, 8 or 10 people, and they come in with a certain agenda, and they push that agenda in a very aggressive manner, and they shut down or intimidate anyone that wishes to speak up against it. So there's a few things that are going on. There is the aggressive promotion of these ideas within the organizations. There is the intimidation of other people who try and speak up, who are then feel that their position is at risk, their job is in jeopardy, so they stay quiet. And then there's also the fact that let's say the American Academy of Pediatrics, it has 67,000 members, and they will come out with a policy statement that may have only been approved by a handful of people, but they will present it to the rest of the organization as a fait accompli. This is our position. The American Academy of Pediatrics has the following position regarding transgender youth. This is our position, and that's end of story. So those 67,000 members, they have not been allowed to debate this issue. There's been no referendum, and if there was going to be a referendum, it would have to be anonymous because people are afraid and intimidated into putting down what they really think. And so the public, most importantly, the parents of children who are sitting in the office of professionals or going on the website of these professional organizations, and the parent sees, oh my gosh, the American Academy of Pediatrics, the American Psychiatric Association, the American Association of Child and Adolescent Psychiatry, and on and on and on. All these organizations, wow, there's a consensus. This represents like millions of doctors. But no, there's no consensus. There is no medical consensus. There's a consensus of these small groups of activists who have become the mouthpieces of the organizations. And it's very scary because, doctors and other professionals are busy people. And we don't necessarily have the time to do our own research and really look at what's going on. I mean, for example, if I have a patient who has OCD, and I want to know what are the most recent medications, what are the best drugs to use, I might go to my professional organization website or their journal and look up what they say about treating OCD, and I'm going to trust them. Of course, I'm going to trust them. So the same happens with this transgender issue, that well-meaning doctors, they trust, there's a chain of trust, and they trust their organizations. And so, but, they have to be woken up. They have to be shaken awake. Is that what I want to say? They have to be awakened and to realize that their medical organizations have very often been hijacked, and that the true evidence for all of this whole medicalization of puberty blockers and cross-sex hormones and surgeries, there is no evidence of long-term benefit, but there is evidence of horrific harm. And that is now what so many people are working to bring out. And we've had the Cass review that's come out of the United Kingdom, Dr. Cass, Hilary Cass, CASS, which demonstrated this and changed the policy of the National Health Service in the United Kingdom. Other countries, Sweden, Finland, and other countries are, revising their entire approach toward these young people, and they're saying we just don't have the evidence. So we cannot be doing these medical interventions. So look, it's a rapidly changing landscape. Certainly in the US, it's rapidly changing. And we have almost from week to week, we have like another state that is passing legislation banning these medical interventions for minors. I think we have 26 now states that have banned these interventions. We have different cases that have gone in front of the Supreme Court with positive results. We have a president who is standing up against this. And I feel hopeful, although still the list, the casualties are very high. The numbers of casualties are very, very high, not only of individuals, but of their families. This destroys and shatters families. I talk about that in my book. I have a whole chapter called Mourning the Living, about what it's like for parents and sometimes extended family to deal with this issue and to essentially lose the child that they love.
Our time is flying and we're just about out of time, but the good thing is that you are ticking off all the questions that I had, so this is just going swimmingly. I've had to do nothing. I do just want to ask you this question though, Miriam, and that is that one of the points coming out from our conference is that we want to speak the truth, but we want to speak it in with love and grace. And one of the arguments about this issue is that, no, we should approach this the transgender person, it's about compassion and respect for them and their rights, and they're marginalised and they're vulnerable and they're victims of a binary world. What's your response to that?
Well, we do have to have compassion to a certain degree. We have to have compassion in recognizing that these people are truly suffering, that they have distress, they're confused, they don't know who they are, they believe they can be somebody that they can never be, and so we can have compassion in that way. We can have compassion, though, without agreeing with their false beliefs. I'm not saying that that's easy. And I have a chapter in my book that walks people through, I have a model conversation between a parent and a child who is first coming to their parent and saying, I think this is who I am and I want a new name and new pronouns, et cetera, and how the parent in a loving way can speak to the child and listen to the child, but remain anchored in reality. We must remain anchored in reality. We are not doing a favor to anybody to let go of that anchor. Are they going to be unhappy with us? Sometimes very, very unhappy. Are they going to be angry? Sometimes, absolutely. And the problem is that they're being told by the rest of the world that people, parents, grandparents and others who don't accept their authentic selves, quote unquote, are toxic individuals, are bad individuals, and to get away from them. And that's a travesty, because these kids are sometimes taken away from the people that love them and are most devoted to them. So it is a tricky thing. It's a tightrope that you sometimes have to walk. And you have to be sure and tell the child or the young adult, I love you and I want to be here for you. And I see how important this issue is for you. And because it's important to you, it's important to me. I am going to do all the research I need to do to learn everything that I need to know on this subject. I'm going to read what the experts say on both sides. And then you know what? Maybe we can sit down and talk. There's lots of videos out there. There's videos of detransitioners, very, very powerful. I know you had Chloe Cole there last year. There's other detransitioners who are very articulate, brilliant young people who talk about their experience. Maybe, you know what? Maybe we could just sit down together, and just watch one of these videos together. And then if you feel like it, we can talk. If you don't feel like it, we don't have to talk now, but maybe you could watch. And the thing is to try and keep that bond alive, to try and keep that child close to you. There's much more to a child, to any person, than their gender. There's so much more. And try to stay attached through positive experiences, going out, having their favorite food, cooking, sports, going places together, music, game. There's so much you can do together. Don't let them put gender at the middle of everything.
You have wrapped that up perfectly. Miriam, thank you so much for your time. I wish we could have another hour, but people can have more than an hour with you. They can simply read your book. And it is it's a great read. Great's not a good word either. It's an important read. And so we really appreciate the work. Just one quick question, Miriam. You know when you're on Daily Wire, What is a Woman? Did you know that you were going to be the only person who didn't come across as a complete quack job?
No, I didn't know at the time, no.
No, okay. Well, you did well. You did well. I mean, I think you gave everybody the assurance that there were still normal people in the world. So it was really good. Congratulations on that. Miriam, thank you for your voice.
Thank you. Thank you so much. I'll just say one more thing, and that is that for people who don't want to read a 300-page book, you can get it on, it's an audio book, and I actually did the narration, so you can hear me getting angry as I'm reading it.
Thank you, Miriam. Thank you.
Okay, you're welcome. Bye.